Telemedicine is the way we transfer medical information through technology. Using this innovation, physician, patient, and specialist can be easily connected through internet, so we can make the right expertise available anywhere and reduce unnecessary patient transfer. There are two types of telemedicine. The first one is real-time, but what we are discussing in this paper is about the store and forward. Just we need the camera to record the video clip, and then a way to transmitting data. Then we can analyze it from anywhere. We reviewed the literature about children with complex movement disorder. It showed that email attached with video clip was successful to be used for inter-institutional communication. And photographic-based goniometry is shown to be reliable for measuring range of motion of the elbow. According to this paper, we think if only photograph would predict range of motion of the elbow, then video clip with subjects in motion should be more reliable because we can pick the maximum angle from any point of time. So, the objective of this paper is to examine the reliability of the video clip-based goniometry method for measuring range of motion of the elbow. We calculated the sample size by past 2008. It showed that 30 subjects is necessary to detect greater than moderate reliability. The funding source was granted from Faculty of Medicine, Srinagarh University, so there is no conflict of interest. Inclusion criteria is subjects, hospital staff aged from 18 to 50 years old, which excluded by people who has obvious deformity of the elbow that include the use of standard goniometer. So 15 women and 15 men were recruited. The clinical range of motion measurements were performed by specialists in elbow surgery by standard goniometry for elbow flexion, extension, forearm pronation and supination. And computer range of motion measurements were performed by specialists in elbow surgery and fourth-year orthopedic resident by available software from internet called PIC. On the same day, the range of motion measurements were performed. Video recording of all patients were performed in the same protocol. Then 1 week apart, the computer range of motion measurements were performed. So this is the first part of this paper to examine the intra-rater inter-method reliability. And then by orthopedic resident, different rater but the same method. So it is the second part of this study to examine the inter-rater intra-method reliability. And then in separate session 1 month later, computer range of motion measurements were performed again, the same rater and the same method. So it's the third part of this study to examine the intra-rater intra-method reliability. We calculate the statistic by SPSS version 17 for intra-class correlation coefficient. This value can range from 0 to 1, with higher value indicating better reliability. And then blind arm analysis was used to compare the agreement. In discussion later, we will use the upper limit of agreement at 10 degrees to accept or refuse this video clip-based technique. For blind arm plot, the x-axis is the average of the two methods, and the y-axis is different between methods. Horizontal lines are drawn at the limits of agreement, which are defined as the mean difference plus and minus 1.96 times standard deviation of the difference. If the subjects were within this line, these two methods may be used interchangeably. For the result in part 1 by specialists in elbow surgery between clinical and video clip, the ICC showed excellent in elbow extension and fair for elbow flexion, but poor for forearm pronation and supination. However, for blind arm plot, most of the subjects were within this reference line, so these two methods may be used interchangeably. For part 2, between specialists in elbow surgery and orthopedic residents from video clip, the ICC showed good in elbow extension and fair for elbow flexion. For blind arm plot, most of the subjects were within this reference line. For part 3, by specialists in elbow surgery from video clip in separate session, the ICC showed excellent in elbow extension and forearm supination, and good for elbow flexion and forearm pronation. Like prior data, for blind arm plot, most of the subjects were within this reference line. For discussion, Part 1 confirmed the hypothesis that video clip-based goniometry is reliable for measuring range of motion of the elbow, especially for elbow flexion and extension. And Part 2 showed the generalizability of this technique because the result from first-year orthopedic residents still reliable. Our results confirmed those of O'Driscoll, who report that photographic-based is less reliant on observer experience than clinical goniometry was. And Part 3 showed the reproducibility of this technique because the results when measurements were taken again in separate sessions 1 month later still reliable. So the conclusion of this paper is video clip-based goniometry method for measuring range of motion of the elbow is reliable, generalizable, and reproducible. This offers a great opportunity for follow-up outcome assessment on patients who live in remote regions or cannot return to hospital for clinical examination. I hope you enjoy this paper. Thank you for your attention.